أهلا بكم. أنا هاني نعيم بكلمكم النهاردة من روما من مؤتمر الجمعية الأوروبية للسكر التهاب الأعصاب السكري النيورودياب، وده الجمعية المختصة بدراسة التهاب الأعصاب السكري. معايا النهاردة صديقتي دكتورة ميترا تافاكولي، أستاذ التهاب الأعصاب. Hello, Mitra. Nice to see you.
Hello.
Yes, will you please introduce yourself again?
My name is Dr. Mitra Tavakkoli. I'm Associate Professor at the University of Exeter in England.
Yes. Okay. And as an expert in diabetic neuropathy or in neuropathy generally, uh, I would like to ask you today about obesity-related neuropathy. So, first of all, I don't think many people know that being obese, like myself, per se, without anything else, causes neuropathy. Would you please elaborate?
That's a very important topic, and this is what oversight in recent years. Obesity has a direct correlation with the incidence of neuropathy, regardless of if you have diabetes or you don't have diabetes. We've done actually recently a big study in over 500 people, and we look at the patients with diabetes, before diabetes, or they call it pre-diabetes, and the healthy people that they don't have any causes of.
These are three different
Three different people,
okay.
yes.
Okay.
And in each group, we look at those people based on if they are obese or they are not obese.
Okay.
We found very interesting results that even in the healthy people with no diabetes or no pre-diabetes, the level of the nerve damage is significantly different from their other people of their groups with no obesity.
Now, please define obesity.
Obesity is defined when the BMI is higher than a specific level.
Okay. What's the level
in
for
each
that?
difference, ethnicity is different.
Of course.
Therefore, generally, they say, like from the UK point, is like over 27. It counts as a obesity, but that depends on the height and the weight of population.
Okay.
This is a study that we've done.
BMI means the weight in kilograms divided by the height in meters squared.
Yes.
Okay, please continue.
Therefore, if we consider the more Eastern countries,
yes,
like Japan, China, the people are having a shorter height. Therefore, in those countries, the WHO and the local guidelines recommended any BMI more than 27 can be counted as a extreme obese.
Okay.
And over 25 is obese.
Okay.
Therefore, in that population, and BMI of 25 is, I think, nearly 70% of population goes in that category. Therefore, in that study, we look at people with BMI over 26.
Okay.
And average from that 500 people, most of them the average was around 27, which doesn't make them even very obese. But still
I think 27 back in my country is considered quite thin.
Yes, absolutely. And even with the 27 compared to 23, there was a significant evidence of changes in the nerves with doing various techniques, even like nerve conduction, looking the perception of hot and cold sensation, cardiac tests, and more complex tests like looking the corneal nerves. When we move to the cohort with the prediabetes, or they call it impaired glucose tolerance, that was the same pattern. Those obese subjects, they were worse than the non-obese one.
They were worse.
Yes.
Okay.
And the type 2 diabetes, it
was
much more
worse,
severe. But one very interesting point that we found is that those prediabetes have actually worse nerve fiber damage compared to diabetes.
Okay.
The reason is that because diabetes already have been diagnosed and they are in the treatment.
Yes.
But the prediabetes, which is count 1 out of 5 people in the population, they are not in any treatment.
So are you saying that people with diabetes, were their blood sugars lower than the people with pre-diabetes?
Yes, or they are under control for their blood sugar.
Isn't this a bit difficult?
Blood pressure.
Because
that's the reason they say that
it's pretty impossible to get people under 5.8 without having significant problems.
Yeah.
So in your group, they were all controlled under 5.8. Isn't this a bit strange?
Yes, but they did undergoing the test of oral glucose tolerance test. That
Yes.
means that they don't have diabetes,
Okay.
but that intolerance and the changes in the blood sugar
Yes.
makes them more prone to the damages that can
Or
cause.
is it other treatments like blood pressure and
Yes, the blood pressure,
the blood cholesterol? for
and then
example?
the lipid profile, everything. I think that
Yes.
plays an important factor.
Okay. So, what can obstructive sleep apnea play a role in this?
It can. There is lots of study evidence that can play an important role, but in our research we didn't look at
Didn't look
that.
at it.
Yes. The other interesting factor we found in that study was that the healthy subjects,
Yes.
they take more statin than any other two groups,
Really?
which is what's quite interesting, because like 21% of healthy subjects in the same matching age groups use the statin compared to prediabetes and
Statins are the
diabetes.
the cholesterol
Yes.
drugs. Okay. Can it be that statins have a direct protective effect on the nerves?
This is, I think, too naive to conclude that. There are more
Yes.
study and research is needed.
Research.
But that was what was a very interesting point from that we didn't expect that.
Mhm. Okay. So now we have already covered the corneal confocal microscopy, or testing the cornea
Yes.
for neuropathy, and we have covered other tests for neuropathy. Strange you didn't mention pseudoscan.
For the autonomic function, there are a variety of the tests that we can do. Pseudoscan is one of them, neuropad, and the vagus system.
Yes.
Therefore, in our research center, we are doing a combination, a battery of all of those tests, including the pseudoscan, neuropad, which is the autonomic function for
Yes.
sweet gland function, and the vagus system, which actually measure over the Valsalva.
The Vegas, yes.
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 And
You know, in my clinic, I do Vegas for everyone.
yes, we do it as well now for our research, and we use also the questionnaire.
Not for
compass.
research, I'm talking about real people.
Yes, you have a very good center, very high technology. But in England and the UK,
And also, I do pseudoscan for everyone.
perfect. And that's quite interesting results. Yes, we found it.
One of the very strange results I found is that nearly 80%
Yes.
of Egyptians with diabetes
Yes.
have some degree of autonomic neuropathy.
Yes.
I'm talking like full-blown autonomic
Yeah.
neuropathy, 2 positive tests or more, came out 38%.
Yes, we found it as well. We do it now for all of our research in diabetes and non-diabetes, using a compass questionnaire.
Yes.
And doing a vagus, neuropad, and pseudoscan.
Yes.
And we found actually those markers are much even more sensitive than the small fibers like corneal nerves.
Really?
And it can detect the neuropathy in much higher level of population,
That's
which is very, very, I think, important.
That's
And
very interesting.
it would be important, I think, what we are thinking now to do it in a general population, because lots of people, they are not aware of the cardiac or autonomic neuropathy in general, and they are maybe suffering. That may be a precondition before diabetes and other conditions.
You know, I have actually diagnosed a very significant number of people who have real
Yes.
coronary artery disease.
Yes.
So this is disease of the blood vessels in the heart. And I'm talking real significant coronary artery disease requiring operations, cabbage, stenting, who had absolutely no symptoms whatsoever. They could go up 7 floors of stairs, and like, if I get a bit breathless after 5 floors, I would get breathless after the second floor. Yeah, they can do 5 floors and nothing.
Yes.
And they have nearly totally clogged arteries, and they have no problems at all.
Yeah, that's exactly the same what happened to my father last year. He went to see for an annual checkup, and he's lucky because one of the lead consultant in cardiologists was his past student. Therefore, he invites him every year to go, and he did all of the tests, the exercise tests and everything at that visit last year. And then the cardiologist asked him to go down to level 1 and then come back again. And my dad came back and he was okay. And he said he's very surprised because he looks at all of the arteries are blocked. And my dad didn't have any symptoms. He asked him not to leave the hospital that day and asked one of the cardiac surgeons to come. And the cardiac surgeon came and did all of the imaging, everything again, and say, I'm going to do the surgery tomorrow, 7 a.m. And my dad had no problem. And then...
Is this a good thing or a bad thing?
Well, they saved, apparently, his life. The nurses and the team there said, oh, you were very lucky. You did something very good, because he didn't have even one symptoms. And even the photo from him, like the day before, absolutely healthy.
No,
but then they say we have this new imaging system, which is the number 1 in the Middle East, something like that. And you are lucky that we did it that day for you.
You know, I had this patient a few weeks ago. The man came in and he had an HbA1c of 12 or 13, something like that. It was basically on 1 tablet of an anti-diabetic a day. And when he came in, I started him on insulin. Of course, this was a big fight. And I started him with all of these different drugs. And I found that he had changes in his ECG. Standard ECGs before he came in. And he had significant cardiac autonomic neuropathy by vagus device. And I ordered his lab tests, and I started him on treatment for everything. And because of this ECG problem, I told him I need an cardiologist. I started to investigate the problem. And I have learned through time that whenever I find positive cardiac autonomic neuropathy with ECG changes, I treat as if the extreme. Because I have there's probably something serious inside. And I put him on 2 blood thinners, aspirin and clopidogrel. And then I told him I need these tests, please proceed, maximum. I put everything. And then 3 days later, he got the stroke. Okay, he got a vessel got clogged in his brain. And the man, they called me about how to change his insulin regimen with the stroke, etc. And I remember the day that man was at my clinic, he was very angry with me. He told me, you are making me believe that I am ill. There's nothing wrong with me. I have never taken, it's just a single tablet I take whenever I remember, and that's it. Now you want me to do all of this? And I told him, yes, this is very serious. Then, when he came back after he actually had the stroke, the man was very thankful. He said that the disability which is left because of the stroke is much less because of the blood thinners and the control of blood pressure and blood sugar which I had, and all of the other medicines you gave me. Because basically, what you do to the blood vessels of the heart is the same as what you do to the blood vessels of the brain. It's the same thing. And the man was very grateful. Even though he was extremely disappointed the first time, he was very grateful with the stroke.
No. I think the cardiac surgeon say if you do a general, like a screening of the like in a street, and the people, like 70% over age of 50 really have some cardiac problem. And the lucky people are the one that before having any stroke or any problem, they go for the
problem before it happens. You can save the person's life. We know from the trials done by the cardiologist that if you have something which is which hasn't caused something significant yet, and you give maximum medical treatment, it
my dad, he was not overweight or anything. He had a very healthy lifestyle. He was a smoker, but before age of 60, but he stopped and he's 80. And they don't have any fat or something in their diet because my mom is very, very careful. And he didn't have diabetes or anything. If he had any of those risk factors,
at least someone would have looked. But the problem is there was nothing wrong with him. And they said even we cannot do any angio because they are fully blocked.
with no symptoms. And he used to go like 2 times a week swimming and then do lots of gardening.
I hope he's better now.
He is better, yeah. Well, if I show you, you are still recording. But this means that since then, I think any of us need to go to do a screening, yes?
I believe it's something important we should do at least once every 5 years.
Yes.
Especially with our terrible lifestyles
Yes,
and all the stress we
absolutely.
live in.
And we have a much worse lifestyle than their generation.
Yes.
With the level of the stress and work, and you don't believe it, but
Yes, much less exercise than
Yes.
they had. They were forced to walk. They were
Yes.
forced to do this.
and they say you shouldn't have even 1 gram of fat in your diet or something like that.
Well, I don't think there will be much reason to live them.
Yes,
Anyway,
but
I'm very happy to have you today.
That's-
And
I don't have. I'm searching for that. It doesn't come now. But that's great pleasure.
okay,
Show you.
and
But
let's
yes, what we covered was the obesity part and the
Yes, we covered the obesity-related neuropathy and the other form of neuropathy and how to measure them.
Yes.
There's the vagus, there's the
Yeah.
pseudoscan, there are all of these things. And we should screen people. Okay, and when we do screen people, we usually tend to find problems
Yes.
which are remediable. Finding the
Yes.
problem is the first step of the solution. I hope your dad is fine.
Yes, absolutely. And the other thing I need to add, apart if the patient doesn't have access to this amazing new technology, which is not available in many clinics, at least they can do like the blood test and the routine lipid profile once a year, that showing that the statin in the healthy subject was much more used is quite alarming. That's why our diabetes or prediabetes, they don't take that high lipid that seriously.
That's a big problem.
Yes.
It was because of the media scare. It's
Yes.
absolute rubbish.
Yes.
Absolute rubbish. Statins are very good drugs.
Yes.
Very good drugs.
Yeah.
I've seen statins do miracles. I've seen statins open clogged arteries. I've seen statins improve kidneys. I've seen
Yes.
statins do so
Even
much.
increase, I think the new evidence show it prevents dementia.
Yes.
Yeah.
Which is the exact opposite
Yes.
of what we thought in the past.
Yes, absolutely.
We thought that statins
Yes.
caused dementia, and actually they improve dementia.
Yes. For my dad, he used taking a statin for many years, but now my mom believes he was mixing his drugs together, and he didn't take the statin like that way. Like he take one once a week or every 2 weeks, and say I don't need that, and he doesn't allow anyone,
Typical.
which just happens for
Typical.
elderly. It doesn't allow anyone to interfere with his drugs, but you don't. And I think
Typical.
yes, typical, especially in the Middle East people. I think even the UK is worse. But
Anyway, I hope
Yes.
he gets well soon.
Yes.
And thank you so much for
thank you very much. Thank you. Nice talk to you.